Well, welcome to an international update. It's Wednesday the 13th of January. Now, I'm going to be looking at the UK and the United States, as we often do. But I'm going to start off with China today, because there's been a few cases, been a small resurgence in China. Now, the National Health Commission has claimed 55 cases the day before yesterday and 115 new cases yesterday. So this is what we're being told. I'm just working on some data now, actually, that shows that the cases in the first wave in Wuhan were massively underdiagnosed. So the cases were much higher than were diagnosed at the time. But then again, they were everywhere, I suppose. But it looks like the initial outbreak was bigger in China than we thought it was. But this is what we know from what the data they've released. 115 new cases yesterday. And they're saying local transmission was 107 of these cases. So looks like some community-based transmission, albeit limited, going on in China. And the Chinese, of course, have responded vigorously. 3 cities are closed down in the area. And I would expect them to get this under control. But it just shows it never goes away. Quite a few in Hebei province. That's near China. But there's also new cases in this province here. Now, this province, Heilongjiang, is near Russia. And there's been cases in this area before the Chinese-Russian border, and I suspect quite a lot of cases are coming across from Russia, where the prevalence is very high, we believe, just through cross-border trade and interaction is probably what's going on there. Now, the World Health Organization panel, much delayed, much debated, is due to arrive in China on Thursday, and to travel to Wuhan fairly soon after that. That's all we know at the moment. We know there's been a lot of difficulties. We know there was a lot of debate, shall we say, about who would be on the panel. And we know that the arrival was supposed to be last week and was delayed. So let's see if they can discover the origins of this pandemic, why we have this pandemic, if this pandemic could have been prevented, how we would prevent another one, and various other things like that this panel is going to investigate. Personally, I'm not holding my breath. But who knows? They might come up with something that they're allowed to publish. Who knows? I'm doubtful, but we'll see. Now, still on the topic of China. China Biotech, the Sinovac vaccine. Now, this is being used in Brazil. And the efficacy, according to data from Brazil, is just over 50%. So studies in Brazil show this has a fairly low efficacy compared to the other vaccines that we've comprehensively discussed already on this channel. So efficacy 50.4%, so just about worth using, but much poorer than other vaccines, which hopefully will be available soon, preventing symptomatic infections. Now, apparently there was many healthcare workers in this trial, which may have skewed the data. And this is just a press release, so we don't know much about it. So this is what they say will prevent infections, prevent symptomatic infections. But, for example, how much it prevents people going to hospital, we don't yet know. That may turn out to be higher. We don't know that. But pretty disappointing, really. I'm sure everyone's disappointed about that in Brazil and in China. But in Turkey, they did a trial on the same vaccine, and they seemed to work out it was 91.25%. Now, can this difference be due to reflect an innate difference in the immune response in these two countries? I really doubt it. There's something not quite right here. This doesn't sound right. Indonesia gave emergency use approval on Monday to the Sinovac vaccine, and their interim data shows an efficacy of 65%. So, I mean, can you do a trial on one set of humans and get that, and a trial on another set of humans and get that, and that be valid data? I think there's more to come on that. I really don't think that makes too much sense as we read it at the moment. Now, still on vaccines. Going on to the Oxford Astrazeneca vaccine, which I've long said is the one I believe is the big hope for most people in this world. A European Medicines Agency received the application from Astrazeneca for approval today. So it looks like Astrazeneca has now made a formal approval request. Now, why didn't Astrazeneca make the approval request earlier? It was presumably because they knew it wouldn't be authorised earlier. So why weren't the European Medicines Agency camped outside AstraZeneca's front door saying, "Oi, send in an approval application"? So very, very tardy response here, it must be said. Disappointing response. And bear in mind, the European Union has got an advanced order of 400 million of these doses, I think, enough to transform the continent. But apparently the European Medicines Agency have been doing a rolling review. So in other words, AstraZeneca has been giving them all the data and fresh data as it becomes available. So the European Medicines Agency should be fully appraised of the data. Therefore, as soon as they're ready to go, well, now the formal application has been received, they should be able to process this quickly, because hopefully most of the work has already been done, because it's a rolling review. Check on that there for yourself. Where have I gone? There we are. So Netherlands has reserved 11.7 million just for itself, with an option on 3.9 million. Not quite enough for the whole population of the Netherlands, although not far off from what I remember. But be good when that happens. And as far as we know, the announcement is going to be, I haven't written this down here, but as far as we know, the announcement is not till the 29th of January. So basically this means that Europe will emerge from this pandemic much later than the United Kingdom. The United Kingdom is part of Europe, geographically, of course. But it's going to be a long way behind. And I would think there's pretty serious questions to be asked in Europe about this delay. But it looks like it's happening on the 29th of January, so quite a long time before the EMA is likely to approve this. After that, it will take individual governments in the European Union a few days to process it. So it looks like the Oxford vaccine will only start being given out in Europe in early February. Really quite an appalling, in my view, quite an appalling delay. And the United States, although we believe it's had access to the same data as everyone else, the United States are going to, apparently, we believe they're waiting for their own phase 3 trial on the Oxford AstraZeneca vaccine to be completed. Check that out for yourself for the details. And that's not going to be completed, we believe, towards the end of March. So again, this really is disappointing that it looks like the Oxford AstraZeneca vaccine is not going to be given out in the United States until April. And in the United States, they have 3 million doses that can be transferred at low temperatures. So again, pretty disappointing stuff, really. We are in a crisis situation. Why people can't move quicker in a crisis? Because this is a global crisis. What bit of crisis don't you understand? I don't know. Anyway, now good news for the United States. Seasonal influenza activity in the United States remains lower than usual for this time of year. Now that's an understatement. What the CDC website is saying is that the levels of influenza and other respiratory viruses and some bacterial infections and gastrointestinal viruses is as low or lower than it's ever been in recorded history. So that is fortunate indeed. Now, I think there's two factors at play there. Perhaps the main factor is that the restrictions that were taken to prevent the spread of COVID-19 is preventing other seasonal viruses, such as influenza. But maybe we've been lucky as well with this particular influenza virus that's prevalent this year, that's not as virulent. So it looks like we've been kind of fortunate there. Now, moving on to other data that you might want to click on for the states, there's plenty. And this following brief for you is based on those websites. So cases in the United States, that's the number of yesterday, another 213,000 cases, nearly 240,000 cases yesterday, giving 22.5 million official diagnosed cases. And that's up This is the Washington Post figure, up 12.9% in the past 7 days. At least I think that was the Washington Post figure. I've looked at a few. You do get people calculate this slightly differently, but that's for sure it's going up anyway. That's the concerning thing. National positivity remains at 12.5%, indicating a lot of community transmission. Not good. Means cases will carry on increasing, and hospitalisation pressure will carry on increasing. And then deaths will carry on increasing in all probability for some time because cases are increasing, unfortunately. Having said that, hospitalizations, that's the latest figure, we've got 121,000, but it's basically been flat, down 0.1% in the past 7 days. I assume this is because hospitals are rationalising who they keep in for SARS coronavirus 2, only keeping in the sicker patients because they're under tremendous pressure, especially in some areas like Arizona and California. Tremendous pressure in hospitals. Deaths pretty high, unfortunately, and deaths are up quite a lot in the past 24% in the past 7 days. So the growth in the United States is continuing, and as we said yesterday, it could take a massive leap forward as this new variant becomes more prevalent, unfortunately. Now, we will look at the vaccination map later on, but for now let's notice that getting on for 10 million Americans have had their first dose. We know this change in strategy now from the Trump administration that's rolled out all the vaccines quickly, and the Biden administration is going to follow suit as far as we know. And getting on for 1 million have had their second dose. That's 0.28% of the American population. Now, it's good that these have had their first dose because we believe that they're going to be largely protected from hospitalisation. Slow start, long way to go in the States. A vaccine that would be transported at normal freezer temperatures, I believe, could only help the situation. Now, I put this in, I thought this was interesting. San Diego Zoological Park, January the 6th, 2 of their gorillas began coughing. January the 8th, test detected virus in the troop. I think 2 gorillas were positively diagnosed. Now, this, of course, is not nice for the gorillas, and of course, we don't want that. But it also shows that the virus is passing between similar species. Of course, humans and gorillas are relatively closely related. So perhaps not too surprising that gorillas could be infected. Of course, we know that less closely related animals such as mink have been infected, and we know the story of that one, unfortunately. Aside from some congestion and coughing, the gorillas are doing well. This is a statement from the zoological park. So glad to see the gorillas are doing well. The troop remains quarantined together and are eating and drinking, so that's a good sign. But the troop is quarantined in what we might call a bubble, I suppose, a gorilla troop, a bubble. And the authorities and the vets seem to be hopeful that they're going to make a full recovery, as indeed do most humans. So interesting there. Now, there's no suggestion at all here that the zoological park are in any way that they were trying all year, of course. Apparently, it was an asymptomatic member of staff that transmitted it, despite following all the recommendations. So the park has behaved impeccably as far as we know, following recommendations from the CDC and, of course, from various veterinary bodies as well. So another important implication there is if the virus does get into animal reservoirs, I mean, I don't know, animals that are around, like in this country it might be foxes or badgers, would that represent an animal reservoir that could spill over, causing human infections from time to time, making the virus harder to eradicate? Possible. If the gorillas, going back to this case, if the gorillas did get sick, then I'm sure the vets have learnt a lot from human medicine, and we'll be able to treat them much more effectively than previously was the case. But they do seem to be getting better, so it looks like the whole troop is going to make a good recovery. So that's good to know. United Kingdom cases carry on increasing, but at a slightly lower level, 46,000 down to 45,000. Over 3 million official diagnosed. So there's still an awful lot of people. I mean, 45,000 people to get diagnosed in a day is an awful lot of infections. So the total number of infections is still growing very quickly, but the rate of growth is slowing. It's not as high as it was a few days ago. So there are encouraging signs that what we're doing in the UK is starting to have an effect, despite the increased transmissibility of the new variant. Estimated R number is 1 to 1.4, pretty wide estimates from the government website. Daily infection growth range was between 0 and plus 6 cases, 6% per day, and that was on the 8th of January. So now we're on the 13th of January, we believe that is slowed down a bit. Well, we believe it's slowed down quite a bit. So the rate of growth, it seems now we could say in the UK, I don't say we can say it's definitely going down, but strong indicators that it's going down. So some hopeful signs. Cases in the last 7 days, 389,000 cases, down 0.5%. And again, that is based on, I think that's pretty well based on current data actually. So new cases, the number down slightly, but remember we've got a lot of new cases to add. And of course, this huge number of cases are going to feed through into a proportion of hospitalizations and a proportion of deaths. So the pressure on the hospitals is not going away any week soon. It's going to be some weeks before this happens. Just to evidence that, hospitalizations now at a completely unsustainable level. Day before yesterday, 32,294 patients hospitalized. This is putting stress in hospitals in virtually all of the 4 countries of the United Kingdom. This is a crisis situation, and it looks like getting worse for the next few weeks. It's hard to see what is going to happen towards the end of January. Last 7 days, hospitalizations were up 34%. So there was 26,914 hospitalizations in the last 7 days. So obviously some have been discharged, but that's up 34%. This is just horrendous. Death figure yesterday, 1,243. This is pretty grim stuff actually, and we know that there'll be a lot of deaths in the next weeks as well. Again, inevitable, baked into the numbers. But very high daily death figure there for the UK. Horrendous actually. Last 7 days there was 6,898 deaths, up 45.6% on the week before. So again, deaths carry on increasing. So some indications that cases are levelling off. That will feed through into hospitalizations, but going to take a bit more time. That will feed through into deaths, but will take a bit more time after that. So it's going to feed through into hospitalizations in 13 days' time on average. And it will feed through to increased deaths in about a month's time. So in other words, we can say fairly clearly that peak deaths is going to occur about a month after the peak incidence, which was around about 4 or 5 days ago. So the peak in deaths should be about 3.5 weeks from now. Then hopefully it will decline, but it will decline proportionately in that period of time ahead to what the cases decline, to how the cases are declining now. Deaths, according to death certificates, give a slightly higher number. So that is the number of deaths within 28 days of a positive diagnosis, 83,000. 93,000 deaths where COVID is mentioned on the death certificate. First dose of vaccine received, getting on for 2.5 million as of, in fact it's now over 11.5 million because the data's at least 2 days delayed. I mean, that's the data on the website as of today, the 13th, but there's a delay in the data. So it's starting. It will accelerate. It has to. Right, unreserved apologies to the government of Sweden. Let me show you why. Here's their website giving the data that I said I couldn't find. Now, this is entirely my fault for not learning Swedish. Why on earth they don't put the quantitative data on the same website as all the other data, I've no idea, but they don't. So that's why I couldn't find it. So I've had I wouldn't say an avalanche, but maybe about 50 to 100 messages saying, oi, Sweden does publish data. And rightly so, here it is. Right, so this is the number of cases. Remember, Sweden's got a much smaller population than somewhere like the UK. They don't give the number of hospitalizations on this dashboard. That one there means intensive care, and that one there means deaths. So good to see the age profile there. More people in the younger age group being diagnosed. Of course, as we would expect, more people in the older age groups going to intensive care. And as we would expect, more people in the older age groups, of course, sadly departing and no longer with us. So cases there. First wave greatly underdiagnosed, of course, massively underdiagnosed. I mean, in the UK, the first wave was underdiagnosed by a factor of about 50, just because we hadn't got our act together on testing. So no reason to assume it's not the same in Sweden. So this is patients in intensive care. So we do see a drop-off actually in cases and intensive care admissions. And we do see a drop-off in deaths. So it looks like things are improving in Sweden according to this data here. So that's encouraging to see. The death numbers, of course, were accurate in the first wave and in the second wave. So it looks like they're falling off more quickly. Let's hope the strategy works. I get lots and lots of angry emails and letters saying Sweden hasn't done a full lockdown. We were critiquing, shall we say, the Swedish lockdown yesterday. But, you know, you can't compare Sweden with the UK or the United States. Sweden's a huge country. It's Scandinavian. Okay, there are some densely populated areas, but nothing like London or nothing like New York or nothing like San Francisco, or where there's Los Angeles, there was a lot of cases. So you can't compare the countries. The idea. So I was on a news interview with a particular American channel, and they said, well, the Swedes, this was in the first wave, they said the Swedes didn't lock down, and they're doing quite well, therefore we didn't need to lock down either, did we? Leading question. And I said, no, emphatically you did. You know, the idea that you can do simplistic is the word actually, naive comparisons between Sweden and other countries is simply not valid. So anyway, my apologies to the Swedish government for not realising that their site would be in Swedish. Right. Also, Johan's contacted me from Sweden. I do know who Johan is. Variants of today. So he gave me this site here, as many of you did actually. Now, in Sweden at the moment, what they're calling the British variant, it was actually first identified in the UK, 25 cases. 8 of those have no travel connection. In other words, the new variant is now in Sweden, thankfully at a low level so far, although of course this will represent underdiagnosis. If that becomes more prevalent, then we can expect the cases to start rising again in Sweden. I think without doubt the cases would start rising again. As they did in the UK, because of the increased transmissibility of this wretched, as we said yesterday, absolutely wretched new variant. We would have been so much better without this new transmissible variant. It really is unfortunate, but not entirely unexpected, to be fair. South African variant, 2 cases. Let's hope that doesn't get out. But both of those travel from South Africa, and I do hope both of those are quarantined. I'm sure they will be. So the greater concern there looks like the community transmission of the British, as they're calling the British variant, the 2012 501 mutation, and Let's hope that that doesn't spread widely, because that will transpose into increasing cases, as indeed we predict, unfortunately, will be the case in the United States. Now, Bangladesh, a pharmaceutical company buying 3 million doses of the Oxford Astrazeneca vaccine from the Serum Institute in India. We believe they're buying them for $8 each, and they're going to sell them at $13.27. I mean, this is just so unfortunate in my mind that this is happening in the middle of a pandemic, that commercialisation is taking place. I'm sure many of you find that as distasteful as me. Won't be the first time that's happened in some Asian countries, as in, well, in all countries really, but it's just sad. It's just sad to see. Really quite sad to see. Now let's have a look at the vaccine tracker. I'll give you the link for this. Now this is one of those really interesting addictive ones, as always. China vaccine, which seems to have a low efficacy, but the vaccinated only 9 million, not as many as I'd thought. Russian vaccine, which is looking more efficacious as far as we know, 1% of the population vaccinated. Canada still lagging behind, it has to be said. United States, 3% of the population's had a first dose. France, still pathetic. Portugal, bit better. So France has done 0.29% of its population. Italy, a bit better. Germany, a bit better. Sweden, 0.77. Norway, 0.4. UK, 4.3 according to this. 4.3%, 2.8 million doses. Yeah, that's right. Sorry, yeah. Leading the pack, we have Israel at 21% of the population. And Bahrain also doing quite well, I think. 6.2%. Kuwait, Bahrain. That's United Arab Emirates. Oh, that's Oman. Okay. Anyway, pity to see such low doses in Argentina. Brazil is not registering yet, unfortunately. French overseas territories. Africa, nothing. This one surprises me. Australia. This one surprises me. Anyway, there you go. Quick update on where we are. For most of us, things are going to get worse in the next few weeks before they get better. Okay, that's where we are at. That is the reality of the situation. For now, thank you for watching.